Hi, good night, everybody. It's nice to see you there. Check that a group of you is now here. Thank you for your attendance. Okay, let's start. Let me share some screens. And then we are going to start, okay? So let's start the live stream on YouTube. And according to that, we have all in order to start, okay? Perfect. Please, in the Zoom chat, start writing down your name in order to start taking attendance, okay? Do it now because it's going to be easier, I think. Well, today we have an interesting class, I think. We're going to check some details in grammar as an introduction. Can you watch my screen? Please let me know.
Yes, teacher.
Teacher.
Okay, perfect. Please start writing down the names. I'm asking it again. And at the end, we are going to fill the pool to take attendance to the academic supervisor, okay? Now we are 13. Yes, we can start. Rest of the people, I think, are coming through this time. Well, when we talk about medical terminology, we have to consider these grammar tips in order to check our vocabulary and, of course, have the chance, have the opportunity to find our word root. The word root is the most important part because according to that, we get the basic meaning term. With the basic meaning, we have the chance to infer what we are going to talk about. And according to that situation, we get the chance to get in mind which organ or which situation we are talking about. For example, gaster. Gaster is the meaning stomach. So wherever we watch gaster, this combine of words, of letters, this word root, I mean, we know that we are talking about the stomach. So in that way, we have the combining form. The combining form is the word root plus a vowel added at the end. For example, an O, gastro. Now we are more than sure we're talking about the stomach. Moreover, we have the suffix and the prefix. The suffix, usually but not always, indicates the procedure, condition, disorder, or disease. The same as in Spanish. And prefix, usually but not always, indicates location, time, number, or status as a general idea. Similar to Spanish, easy to start talking about it. The word root, in order to take in count, almost I forget it, is coming from Latin terms. That's why it's a universal way of talking. That's why meanings in English are similar than in Spanish. You're going to check that medical terminology is not as hard as sometimes we think, but we have to take in count that we cannot make a mistake while talking, and expressions, the ways we are using this are the most important. According to that, the word root have guidelines, the word path guidelines, I mean. And first of all, it cannot stand alone. It does need a suffix that must be always added at the end of the word. A word root without a suffix it's without a sense, without a meaning, and there's no way to understand it. We can infer, but while writing down, while talking, it's not correct just to leave the word root. The rules for creating a combining form by adding a vowel apply when a suffix begins with consonant and it's added to the word root. You are going to see examples ahead. When prefix is added, it always plays at the beginning of the word. Of course, suffix and prefix, as we were talking about a few minutes. Some combining forms indicating color. In this chart, we have examples. We have the word root cyan, the vowel that is added, the O, and we get cyano. Of course, cyano means blue. We all know about it. Combining with a suffix, cyanosis. We all know that the cyanosis is the blue discoloration of the skin because of the lack of adequate oxygen in blood. We know about it. And you can see how the word root, the vowel added, and the suffix are working together. Another example, word root, erythr. If we just have this word root without the vowel, it's without a sense, right? We add the vowel and we get the meaning. The meaning is red. With the suffix cyte, erythrocyte. In that order, we have the mature red blood cell. We all know about it. Another one, leuc. Leuc is the word root. The vowel added, leuco. Leuco means white. With the suffix cyte, leukocyte. I think you're catching the idea with these easy examples, okay? While talking through the course, you are going to find lots of this. For example, melan, with O melano, with the suffix cis, melanosis, we got the medical term. Poly, we add the O, polio means gray, polio, mielitis. So you can see two suffixes combining and giving us a new meaning. We all know about it, okay? About suffixes, we have some of them that are noun endings. I mean, when you catch these endings, you know that we are talking about a noun. For example, crani is the word root with the vowel added U with the M, cranium, the suffix yum. An abnormal condition, we have all of these meanings. Ago, isis, aya, yasis, ion, ism, osis. And we know this. Gaster, the word root, the vowel O and cis. Oosis could be gastrosis. Easy. Suffixes meaning pertaining to, we have all of these charts to check. AC, ac, for example, al, an, ar, ari, ial, ical, ial, ike, in, iori, os, tic. For example, cardi, the word root, plus the AC, ac, cardiac. Yes, easy to make, right? Now we have suffixes related to pathology. For example, algia, pain and suffering. Example, gastralgia. And then we have all this chart, the most common ones. Dynia, itis, megaly, malacia, necrosis, sclerosis, stenosis. Combining the suffixes with word root, we got the medical term, like a puzzle. You can see this in this chart. Tonsil plus itis, tonsillitis, right? The same as in the Spanish. During medical school, the medical career in Spanish, we get this information indeed while we are talking through the career. That's why it's the moment to talk about it calmly and carefully without any trouble. Moreover, suffixes related to procedures, we have to consider them. Synthesis, graphy, gram, plastic, scopy. The meanings, of course, we all know about it, and how we get it combined with word roots, vowels, and everything. This is, for example, angiogram, arthroscopy. So you can see, easy to make, the same as in Spanish. A grammar rule shows us that the double errors of axis are this, just this for once, rage or raja, rafi, ria, rexis. The meanings, and of course the examples. For ria, for example, diarrhea. For rafi, mayorrafi. For rexis, mayorrexis. So you know, rexis, rupture, and mayorrexis, the rupture of the muscle, right? About prefixes, the grammar rule is the same as in Spanish. It's added at the beginning of the word to influence the meaning of the term. Of course, when we get a prefix, we change the medical term. We change the meaning. An example, prenatal, time and events before birth. Perinatal, time and events surrounding birth. And postnatal, time and events after birth. We see that the prefix is changing the meaning. The word root is nata, and that's all. You can see as a scramble again, pre-nat. The term prenatal, we have the new word. That's why easy to make. Some prefixes describing direction, quantity, size, and amount. We have the most common ones, and then the meaning of this. Up, away from, negative, absent, add, toward, to, in the direction of. So you can check, right? Dextro and sinistro, some of them are coming from Latin, of course. Latin is our language root, could be said. And then it's easy to catch the meaning. Ex, out, outside, away from, in, into, not, without. Macro, large, abnormal size or long. Micro, or micro, small. Mega or megalo, large, great. Oligo, scanty, few. Pre, before, post, after, or behind. So you can check this. While checking these suffixes and prefixes, it's easy to get in mind what we are talking about, how to deduce and get clear about meanings, maybe inferring meanings without making mistakes. Contrasting prefixes, of course, and comparing opposite situations. For example, ab or ab means away from, abnormal could be an example. As means toward or in the direction of, for example, addiction. This means bad, difficult, or painful, dysfunctional. Eu means good, normal, well, or easy. For example, eupnea. Hyper, excessive or increased. Hypertension. Hypo, deficient or decreased. Hypotension. Inter, between or among. Interstitial. Intra, within or inside. Intramuscular. Sub means under, less, or below. Subcostal. Super or supra means above or excessive. Supracostal. So you can see all of them are showing us opposite situations when we compare the meanings. That's why prefixes change all the complete term we have to take in account. A grammar tip, very important. When we talk about, could be in social English or medical English, doesn't matter. We have grammar rules and we have irregular words that are coming from singular to plural, changing the way of writing down and changing details about pronunciation could be. For example, if the singular term ends in the suffix a, for example, bursa, the plural is usually formed by changing the ending to ae, bursa. The pronunciation is the same, but the way to write down changes. You can see different way of writing down. Vertebra, vertebra. The same meaning, the same pronunciation, different writing down in singular and plural. Take this in count, because while writing down, I take it in count while checking homework. Another one, this one. If the singular term ends in the suffix is, for example, diagnosis, in singular, one diagnosis, the plural is usually formed by changing the ending to es, diagnosis. Here the pronunciation changes. There are two diagnoses. One diagnosis, two or more diagnoses, right? One metastasis to one organ, metastasis to few organs. More than one, of course. For example, with this, if the singular term ends in the suffix nx, for example, phalanx, the plural is usually formed by the x adding g's. Easy. One phalanx, two or more phalanges. You can see. Easy, right? Easy rule, but we have to get in mind, we have to practice, we have to read and write down for not forgetting this. This one, if the singular term ends in suffix on, for example, criterion, the plural usually is formed by changing the ending to a, criteria. When we talk in medicine, we don't just use one criterion. We don't have one rule for getting a diagnosis, for defining a situation. We have a group of ideas, major criteria, minor criteria. We combine them, we make formulas, we make rules, we make protocols, and we always talk about criteria. Medical criteria has that characteristic to get as a group of ideas of definitions of specific characteristics, could be said, for defining a syndrome, a diagnosis, a disease. Just found one criterion, it's not common. On the other hand, we have ganglion, just one ganglion that it could happen, and in plural, ganglia. While reading articles, you find these changes to singular to plural, so please read all of them, and according to the rules, while checking, I'm going to take it in count. So read this, study this, it's very important. This introduction is important, rounding information, sorry, because from today we are talking about system, diseases, and symptoms. Today specifically, we are going to talk about signs and symptoms as a general view. Of course, it's not possible to check all the propedeutic contents. There's a lot of information. And it's a resume, I think, following the guidelines of the Institute. According to this, we are going ahead with bones, joints, and muscles as a general view, of course. So let's go. Signs and symptoms. Let's go ahead. Oh, please give me a minute. Okay, I'm sorry, let's continue. I don't know, there was a mistake and the lip stream was not ready. Now it's going ahead. Let me share again. Okay, signs and symptoms. Let's go from this point. Don't worry if you came late, the slides are gonna be into the group. I mean, don't worry, I'm gonna send it as always, okay? So go ahead. When we describe problems, when we go to the doctor, when we are patients or we receive patients as doctors that we are, we receive information. We organize ideas, we get in mind what is going on, and we start having an organized speech from our patient. That's why symptoms are all the problems which a patient reports to the doctor. A synonym to call symptoms are complaints in English. Signs are all the findings, all the things the doctor finds. Of course, findings is the most common way of talking when we refer about complaints and findings. Okay, they are just synonyms to take in account. For example, we have this doctor and he says, Mr. Gomez was admitted complaining of chest pain. Right? It's easy. This verb is easy to make, easier to work on, to catch this idea, and to start using in abbreviations. In case of notes, the abbreviation C/O is used, complain of chest pain. Why we are talking about abbreviations? Because when we are talking about medical English, we use lots of abbreviations for signs, for symptoms, for pathologies, for ways to abbreviate our paragraph while writing down, and don't waste time rounding information. Using abbreviations like this, it's very easy to make a clinical report, a case report, and everything we need. According to this, don't forget this abbreviation, because from this point, in many slides, we are going to check this. And of course, are coming more and more abbreviations related to the case report. About the presentation, of course, we have ways to give an expression, to talk with the doctor, and we have to consider this. When we receive the patient at present, the patient tells us all the complaints, give us all the information, and we organize, we get the diagnosis, and according to that, we have this. Patients say they went to see the doctor. Doctors say the patient presented. You can see everything is in past. You don't have the chance to talk about your patient or a case with your colleague, with the patient next to you, right? Usually it's not happening. That's why when we talk about patients and a specific situation, we use the past tense, and that's enough. About presenting symptoms, the symptom which causes the patient to visit the doctor, of course, is the most important situation. And we can say presenting complaint or presentation. Both of them are similar, both of them are allowed, there is no trouble. So we have these ideas to understand these meanings. His presenting symptom was chest pain. He presented to his GP, to the GP, general practitioner, with chest pain. The usual presentation about this kind of pain could be is chest pain. Now we are giving explanation about the clinical case. That's why this expression is common. But when we talk about the patient, a specific patient, we have to be in past time. Don't forget it, I'm going to check this. About symptoms, talking about symptoms, we have this chart. Very important. That's why the blue guy is here, and we have to check this and understand that we have the patient expression, some ideas how patients talk to us. We have the meaning of this expression, and we have symptoms that describe this description, this phrase of the patient, right? For example, a patient can come and say, I feel tired all the time. Feel tired means loss of energy. Loss of energy, while talking in medical English, could be tiredness, lethargy, fatigue, lassitude. We have 4 options. Another one, I feel completely worn out. This expression, feel worn out, the same, loss of energy, and the same for options. Any one of them is correct. It depends on the context to use each one. Talking about allies. I've been feeling off color for 2 days. To feel off color, general feeling of being unwell. The previous class on Monday, we were talking about unwell term specifically with some students because they were asking for about it. This meaning, when we go to the medical term, is malaise. You cannot write down in the case report the expression of the patient. You only use medical term. That's why it's important to make, could be said, the translation of the expression of the patient to the medical term. We need practice on this, and we are going to work on this all the module 1. Another one. My appetite is poor. So it means loss of appetite. Going to the medical term, anorexia. Please, questions at the end, okay? At this point, we are not asking for not losing or missing this information. Thank you. Another one. We have put on. I've put on 8 kilos in the last year. Put on, talking in the medical context, it means increase in weight. So weight gain when we write down or we talk, when we report a patient or a case. This is the way we have to talk. Another one. I'm not eating any less than usual, but I've lost a lot of weight recently. Lost means decrease in weight. Talking about the medical context, of course. Weight loss in order to write down our report. Another one, my emotions are very hard. Another option, I've been quite constipated lately, or I'm not very regular. These 3 expressions mean hard, infrequent feces. Going to the symptom, to the meaning, constipation. So let's check this. Practice with this chart at the beginning because they are general symptoms, and then it could be easier to talk about it. The verb feel is also used to other adjectives such as hot, cold, nervous, anxious, dizzy, weak. For example, she said she felt dizzy. Very common expression that we use even in the social English. That's why there is no trouble. Okay, so let's practice on this. Let's study this, and tomorrow during the workshop, we can solve these doubts. Going ahead, we have the red guy. This red bag is showing us that this chart of list of symptoms divided by systems, you have to check them, try to memorize if you consider necessarily, or get the meaning in order to talk about, to practice, to start reporting cases, right? All of this information, of course, we are not reading during the class because there's a lot of lists. Some of them, like this list, are comparing one column to the other in order to check if there are different ways to talk about, but that's okay, don't worry. Check this and tomorrow we can talk about it, okay? There's another one. You can see there's a lot of information. And let's start with bonds. Of course, bonds is a very important part. And we have this chart, the overview. The overview of this lesson is showing us the structures, the combining forms, and the functions of the skeletal system. I mean, the major structure, what we are talking about bones, the anatomical parts. Then we have the related combining forms, and then the primary functions, okay? The major structure in bones, for example, for bones, we have the related combining forms with os as a vowel word root, with the vowel aret, ose, osi, osteo, osto, and the primary function act as the framework of the body, protect the internal organs, and store the mineral calcium. We all know these meanings because of the middle school. We all have this basis. Please check major structures, how they are written down, the related combining forms, and in order to this information, it's going to be easier to talk about. The primary function, read this in order to catch vocabulary, okay? Very important because it's an anatomical review, of course. And this anatomical review is going to give us the idea how we are going to talk about. For example, cartilage, the related combining form is chondro with the vowel aret. And we have the primary function, of course, creates a small surface for motion with the joints and protects the ends of the bones. We all know about it. Please check all of this information. Going ahead. We have the word parts, very important, a general idea what we are talking about in order to deduce meanings, to get the meanings, I mean. For example, ankle, crooked, bent, or stiff, arthro, joint, chondri or chondro, cartilage, coast or costo, rib, cráneo, skull. This is a suffix. When you see a hyphen, this is a suffix. This is to bind, tie together. Kip or kifo, bent or hump, lord or lordo, curve, sway back or bent. Again, a hyphen, we have this hyphen and it's a suffix, lysis, loosening or setting free, miel or mielo, spinal cord, bone marrow, of course. Again, ose, osi, osto, osteo, bone, scoli, curved, bent, spondyle or spondylo, vertebra, vertebral column, backbone, we have the meaning here. Synovium, synovio, synovo, synovial membrane, synovial fluid, of course, hypenium, singular noun ending. We were talking about it, okay? Consider these word parts for catching the meanings, the anatomical terms, of course, and some pathologies. This is an anatomical review. We all know about this structure. During the med school, from the first year, we have this way of talking. And in English, we have the list showing us all the bone tissues. We have the way of writing down. We have to check this and to remind. As I was telling you yesterday, on Monday, in the first class, during the module 1, we have lots of anatomical reviews, some situation and some exercises, writing down the case report. Anatomical reviews is just for checking, for evaluating, and everything is coming. Now we have this guy, we all know about him, our friend, the skeleton. We have the red guy showing us that you have to check all of this information, how it's written down, and we have to consider this. As I was telling you in the first presentation, we have Latin terms, medical term, and could be said the social term, the common term. In this chart, I'm showing you medical term and the common term. Common term in parentheses when there is a common term. If there is no common term, it's not going to appear. For example, the forearm is composed by the ulna and radius. You can see ulna and radius are in Latin. As I was telling you, Latin and medical term are mixed in English books, in American books, for making it an elegant way, for taking in respect, or in a great position, the history through the time of medicine about the language, and that's important, okay, to consider. So if you read in Latin, don't worry, that's okay, that's great. The charts that I'm showing you like this, that have the common term and the medical term in Latin or in English, are the ones that I'm going to take in account for homework and tests. So consider this, let's go ahead. Study, check, and any question you have about pronunciation, we can solve it tomorrow during the workshop. Common names. The common names of the anatomical structures are the ones that Legos use for talking, for practicing, and for showing us that everything is important, that everything has an anatomical name and a common name, because we have to get in difference this way of talking. For example, common name of a skull, we know that it's cranium, jawbone, mandible, spine, vertebral column, breastbone, sternum, rib, costa, collarbone, clavicle, shoulder blade, scapula, thigh bone, femur, kneecap, patella, shin bone, tibia, right? You see how Legos talk, how doctors talk. The difference has to be done. That way of talking has to be taken count in order to speak properly between colleagues and speak properly with not medical people, with Legos, with patients, with friends. That's why we have to consider, okay? And even in Spanish, we have the same rule. Going about pathologies, we consider fractures. And of course, it's the break in a bone. A pathological fracture is a fracture in a diseased bone, of course. An example is a fatigue or stress fracture that is due to repeated minor trauma. For example, long distance marching or running. It usually happens in elderlies. Here we have this chart showing us the typical bone fractures, the most common, the green stick, the spiral, comminuted, transverse, compound, compression, okay? All of this, we all know this classification during the med school, so let's go. More fractures, talking with Legos, talking with not medical terms. Skull fracture, okay? Thigh fracture, forearm fracture, finger fracture, rib and clavicle fracture, toe fracture, leg fracture. Of course, this is a phalanx fracture, and we have to take it in count. Just consider this when you go to talk to your patients to explain the situation. You don't use medical terms like this. You don't use these anatomical descriptions because they get in confusion. They run mad and then they don't understand anything. And it's not our mission to do it. Some X-rays, the green stick fracture, when we have the description, how the parts are moving. We have the cortical break, the buckle, and the radius and ulna, of course. The green stick, very typical fracture, I think, very common. We have the chalk stick fracture, very common in elderlies. And you can see, again, this amount in volume, the buckle, is repeated here, the buckle again. And you see a line here. This is the chalk stick. We have the compression fracture. Of course, we know the difference in size in a vertebra. That's why it happens. We all know about the stress fractures. The stress fracture, very small. You can see here the buckle. The buckle here is showing you that there is a fracture. For practiced eyes, with experience, you can find this. It's very common to miss this, so don't worry. About the healing bone process, just as an information, we have this chart showing us the processes. And please read it in order to catch vocabulary. Okay, it's important to check anatomical structures, anatomical processes, physiological processes, and descriptions for catching ideas how we must talk about from this point and ahead, how we can describe these processes, for organizing ideas and getting an example, how we can talk about these situations, okay? We have this kind of fracture in a newborn. It happens when the labor is traumatic, when there's an accident or the baby falls down, it could happen. And we have all the process of healing here organized. We can see how it's recovering, right? And according to this, just check the description and then try to catch this way of expression and more vocabulary and more ways of talking. About the treatment of fractures, we have to consider this. There is not just place a cast and that's enough. So we have to consider the blackened words to get an idea what we are talking about. When the fragments of a broken bone heal and join together, they unite. Union may be promoted or helped by reducing the fracture, the same as in Spanish. We reduce a fracture, we don't replace it. We reduce the fracture and we promote the union. That's the replacing of the fragments in their anatomical position if they are displaced. It could be wild movements like here, antique techniques, I think, or surgical replacement. But this is the surgical reducing of the fracture. After the reduction, excessive movement of the broken bone is prevented by a fixation. It could be external, for example, a splint, or internal, or with a plate and screws. This is the splint, the cast, an external fixation or an internal fixation, the plate and the screws. You see how the screws are in contact with the bone, placing it on its position, anatomical position. A displaced fracture, which is not reduced, may result in malunion. You can see there is a malunion. There is a malunion. Incomplete or incorrect union. You can see the difference, right? How anatomically everything changes, and of course the function changes. Complications, of course, malunion or non-union, that it could happen. We have differences between cast and splint, just as an information slide to take in account when a cast is done and how it must be developed, and when a splint is done, is placed. Splint is partial. We can place and remove as many times as we need, or maybe replace it, but the cast, no, the cast has to be placed without making a mistake. It has to be done by into a hospital, could be an MT in the field. It has to be into the hospital, not in an emergency place or on the pre-hospitalian attention. It takes quite a long time to make. On the other hand, the splint is easy to make. We use it to make a partial fixation to go to the hospital without more complications of the fracture, of course. We have examples of cast and examples of splints. You catch the difference now? Well, of course, there's a joke, just for having fun. I like to send them. Joints. Joints are also known as articulations, are the place of union between two or more bones. Again, I will read back to check anatomical landmarks, anatomical details, more vocabulary to memorize maybe. But you can see it's the same as in Spanish. Very, very, very similar. That's why it's not as difficult as it's talking about anatomical review. We have fibrous joints, cartilaginous joints, and synovial joints. The fibrous joints, we all know these structures, inflexible layers of dense connective tissue, hold the bones tightly together. Fontanelles, or in common term, soft spots in the newborn, and the sutures in adults. Cartilaginous joints, allowing only slight movement, bones connected entirely by cartilage. Could be ribs or the pelvic symphysis. Easy, right? And then we have the synovial joints, allow a variety of motions, articulate, come together. We all know the knee, for example. We have this structure, the elbow, for example. Check the anatomical details. And if there is any trouble about pronunciation, we can talk about it tomorrow, okay? We have the classification of joints, how we get them in order, the 6 major types to consider with its own description and the position, how they move. Please study. This guy is showing us that did his homework. Okay. Now we have the difference between tendon, ligament, and cartilage. A tendon is a band of tissue that connects muscle to bone. Tendons are inelastic and tall. They go with as a connective tissue and function. It connects ends of the muscles to any place of the bone. The ligament is an elastic band of tissue that connects bone to bone and provides stability to the joint. They are elastic and strong. They also connective tissue, and it connects bones to bones as joints. And the cartilage. Cartilage is a soft gel-like, could be soft gel-like padding between bones that protects joints and facilitates movement. Are stiffer than ligaments. They are in the skeletal tissues. It protects bones and stops them from knocking together by acting as a cushion between bones. So you can see anatomical review just. And now we have charts like this. In this charts, I'm just showing you a list of pathologies that we studied during the medical career. During the workshop, we can talk about in a specific way, about a detail, but the objective of this course is not studying medicine again, it's catching vocabulary, medical vocabulary. That's why it's important to get it in mind. I'm going to show you these pathologies for catching the idea how to write down these names because they are specific names, and then it's easier to study. Please check all of them, and we can talk about pronunciation tomorrow. There is not enough time. About muscles, again, we have our chart with the overview, with the major structures, the muscles, fascia, and tendons, the related combining forms for muscles, musculo, Musculo, mayo, mayos, fascia, fascio, tendons, teno, tendo, tendino. So take this in count. We have the primary functions. Muscles make body movement possible, hold body erect, move body fluids, and produce body heat. Fascia cover, support, and separate muscles. Tendons attach muscles to bones, as we were talking a few minutes ago. The word parts again. Now we have a prefix. This B and a hyphen is showing us that this expression is a prefix. B, twice, double, or two. The suffix ele, hernia, tumor, swelling. The prefix this means bad, difficult, or painful. Now the word roots and combining form. Fascio, fascia, fibrous and band. Fibro, fibrous tissue, fiber. The suffix aya, abnormal condition, displays. The plural is ium. Again, a suffix ic pertaining to the word root. Kines, kinesio, kinesio, the movement. Word root mayo, muscle. Suffix plegia, paralysis, stroke. Again, suffix rexis, that is rupture. Word root tax, taxo, coordination, order. Teno, tendo, tendino, tendon, stretch, stretch out, extend, strain, so you can see. Tone, tone, straining, tension. And the prefix tree, that means tree, of course. We all know about it, the same as in Spanish, just changing the writing down way. The structures of the muscular system, we all know about it. Please check this information, read about it. And we have, again, this chart that is showing us the tendons and the ligaments. Tendons connect bone, muscle to bone, ligaments connect bone to bone. With this kind of information, I think it's easy to understand and memorize. We have the types of muscle tissue, the skeletal tissue with its characteristics, with anatomical landmarks for remembering, for making our mind, and for catching ideas about anatomical details. In English, of course, the way of writing down is important, and its functions. They are also known as straight muscles, straight, stripped. Now we have synonyms to consider. We have the smooth muscle, again, its functions, where we found it. They are also known as unstraight muscles or visceral muscles. So what I mean, smooth muscle, unstraight muscles, or visceral muscles are synonyms, and we can find it, okay? Then we have myocardial muscle, also known as myocardium or cardiac muscle, of course. According to this, we have to check all of the information about it with anatomical details. When we talk about contrasting muscle motion, we are just considering the body movements, flexion, extension. We know that the triceps contracts, the biceps relax for making the extension, for making the extension of the biceps and the flexion of the triceps. On the opposite, we contract the biceps and relax the triceps. We have pronation and supination, dorsiflexion, plantar flexion, abduction, adduction, circumduction, rotation. And now we have, again, anatomical details, superficial muscles. Please check all of them. Well, in this chart, all of them are in English. Nothing is in Latin, but if you consider one of them is in Latin, we can solve this doubt tomorrow, okay? But this chart is in English completely. It's with the most important structures, I think. I'm not going into very, very small details. We have this class, medical specialties related to the muscular system, the exercise physiologist, in parentheses, we have the pronunciation of the new word, the neurologist, the physiatrist, and the sports medicine physician, right? Read all of this information to catch vocabulary. Now we have the pathologies of the muscular system. The same as in bones and joints. We have the opportunity, well, we have the chance to check how to write down the names of these pathologies. For example, for fibers, fascia, and tendons, we have this list. Muscle disorders, we have this list. Muscle tone, muscle movement, muscle function, sports injuries, lots of them, the most important that I found, repetitive stress disorders. So take in count, read how they are expressed, and check how they are written, and then we can talk about it. And please never give up. Great things take time. I mean, take time because I know, I understand there is a lot of information about it. We have lots of anatomical details, anatomical review to make. And now we have to consider this. It's very, very important to take in account all of this information. Now, I remember there was a question. Do you want to talk about it now?
Oh, okay. Yes, teacher. I have a doubt about the term lethargy. I saw on one of the slides that the meaning of that term is like a lack of energy, but I don't know if I'm asking because I know that words sometimes can be false friends, right? And they don't have the same meaning in English than in Spanish. But in Spanish, that term it usually means that you're moving slower than usual. And it's not necessarily because you are lacking of energy. It could also be like a neurological problem.
Yes, you are right. That's true. When we have these differences in meanings, goes according to the context. In English, we have the possibility, as the same as in Spanish, to find synonyms. And according to the context, you are going to find what you are talking about, the same as in Spanish.
Okay, but in this case, this term has both meanings, right?
Yes, in this case, you can use both of them. There's no trouble for me. Okay. You're going to check when I send you homework. I send you the keys, the answer keys at the end of the deadline. And according to that, almost all of the questions give you the chance that give me more ways to answer that are open, are different. I'm not closed on that way of expression. So don't worry. That's a good question. Okay, until this point, let me send you the poll. Please, all of you must answer in order to take attendance to the academical supervisor, okay? If any of you cannot watch this, please let me know. Please keep on reading, study all the charts, all the anatomical reviews. And if there are questions about meanings, like the question that Jorge has, a very good question at this point, that's good. That's good for me. Don't worry about it. So, as I told you, the first class we had on Monday, and today I'm taking it in account again. We are not teaching medicine again. We don't have that time to study medicine. Maybe details like this, but not all of the context, not the anatomical reviews in detail. That's your job. That's why I sent you the slides, for all of us to have the same information, and then we can work without any trouble, okay? So I think that's all. If there's any question, this is the moment. Something you would like to ask? Hello, everything okay, I think? Okay, perfect. So if everything is done, the pool is correct. I have all my students. Now it's time to go. See you tomorrow in the workshop. And please, the ones that didn't come yesterday, I'm going to change the schedule. You know if you were present or not, and the ones that are not are going at the end, please. Because I didn't receive any situation about it. And if for any reason tomorrow, because of job, maybe a personal situation, you cannot attend the workshop, please let me know as soon as possible in order to get the correct schedule, okay? Please take into consideration, I start at 6 p.m. and stay in the connection around 5 hours. I cannot be in the middle of the workshop without the students. That's why I'm going to move the schedule according to the ones that come and are not coming, are not attending, okay? So see you tomorrow. If there are no more questions, that's great. Give me some minutes.
At the same time, right?
Yes, the same time. The ones that are on time, for example, you were at I don't know, 8:30.
18:45.
Okay, perfect. If that fits to you, it's perfect. You can go ahead. There's no trouble.
Okay, thank you.
I only had 2 students that didn't attend, and they are almost at the end. So they are going to go at the end without any problem. Okay. So see you tomorrow. And if you have any question that you wouldn't like to talk at this moment, please send me a message. That's great for me. Okay. So see you tomorrow. Bye.
Thank you, teacher.
Thank you.
Teacher, see you tomorrow.
See you. Bye-bye. Well, Jamie, we are still here. Okay. Well, everything was here. Everything was done. The YouTube failed a little bit, but I don't know what's going on with this page. It's asking me for some confirmations that I didn't have in the previous courses, but patience, I'm going to correct it now. So everything is done, and see you tomorrow. Bye-bye.